Hey guys, giving you a little look into the backyard here. We did end up going with an aftermarket little fireplace, but more important, this is sort of a video from Max, who's sleeping over there, to Allie. And basically, and to answer a lot of the comments I got about Max when I did the Sierra Design tent video where I mentioned we were doing more car camping. Max had his TPLO cruciate ligament blowout in his left knee, and at first I wasn't sure if maybe it was something that he could bounce back from. Eventually got him x-rays, took him to the vet, found out that was it. The vet's answer was to see a specialist who wanted to do what they call a TPLO surgery. And what happens is the knee joints of dogs are at an angle, and what they want to do is take that bone, cut a perfect circle in it, rotate it, so if my flat part of my knuckles is the joint, and rotate it so the joint meets straight up and down, because the ligament that goes the other way was still intact, and that would help keep the knee from moving. Well, the body's natural ability to keep that joint is basically arthritis. It happens as you get older, and it's a natural reaction your body does to help keep your joints from moving around. Now, he definitely has a little bit less mobility, but in the time I took, basically, one, trying to save money, because that TPLO surgery was like $4,000. Looking for alternatives, I had friends that wanted me to go to Canada. There's a couple other versions you can do where you take ligaments from other parts and hook it on there. And really, in the long-term search, for what I found is when they take the ligaments from other places, is they still stretch like a rubber band. And so although it's more of a temporary fix, the dog has mobility for a short while, eventually it'll go out again. And I couldn't see putting him through the surgery, rehab, for it to not to be really active again. He definitely compensates by the other leg. He runs more with both feet like a rabbit. It still hasn't kept him immobile. It's basically my choice as a sort of responsible dog owner to keep him, as more of a couch dog, less strain. We still go out and do stuff. He's not totally immobilized, but a couple months ago it got pretty bad, and now he's leaving. To the point where every time he tried to get up, he would whimper. And so I really started, it sort of kicked me into, finding more alternatives quicker. And, Nut Fancy had mentioned that Allie was getting Duramax. Duramax is kind of an anti-inflammatory, if you don't know, for dogs. They're able to take, a good amount of it on a regular basis. So in talking to a local guy I found here that was very good, which I'll cover up here. You probably can't see that. It's Rimadyl. And Rimadyl is actually an arthritis medicine. And the second thing is, I didn't really want to get Max on a pill regimen. I didn't want to have him drugged up the entire time, but I wanted something like I had with the Duramax, where if he was a little bit overactive with his joints and it was hurting a little bit more than usual, that I could give him something to help with that. And that's where the Rimadyl came in. The second advice from them, which I later found you can get them on Amazon, these are sort of a vet rated soft chew for the glucosamine, fatty acids, a bunch of other things. Hey, sit. Hey, sit. And they're just little chews, but I've tried giving him glucosamine stuff that you get from the normal dog stores, and they hate these. They're absolutely horrible, huh? Good boy, down. You can see when he lays down, he kind of kicks his hips out sideways. But he gets, a couple of these a day. I'm going to give one to Gracie because it's just not fair. Good girl. He gets a couple of them a day, and I will say over about a month or so of him sort of whimpering and whining every time he had to move left or right or had to get up, he would basically cry. And I gave him the 1 Rimadyl and 2 of those chews, and he hasn't cried since. I've only given him 1 other Rimadyl since the initial dosing. Was another day, you know, higher active. We were outside doing fall chores, and he was playing around. Came in, and that night he was a little extra sore, you could tell, so I gave him 1. But for the most part, it was these Sonova G3 chews that he's been going towards. And you know, they're not super cheap. There's 120 chews in here. I think it was 50 some bucks, especially when you've got a couple others that really enjoy it. But for the most part, you kind of have to get it built up into a system, and then you can give him a maintained dose. But that's sort of the update and what we've been doing with Max. You know, this is not a ploy for cash or anything. This is just what we've decided to do over a $4,000 surgery, and the fact that it could happen to the other leg, you know, especially through the rehab process where he's putting so much weight in the other one. You know, that's basically what happened to Allie. Is, you know, nothing fancy. His family had the surgery for Allie, and sure enough, the other one is going now. So it hasn't really stopped Max. I don't think he really cares that he has the injury. Up until a month ago, it said he was really whining. But other than that, you could never tell. He didn't whimper, he never made a noise, and that was almost a year and a half after the initial injury that, you know, the arthritis, I think, started getting him. So, you know, I'm doing what I can for the money, and certainly don't want just a drugged up dog. But that's what Maxwell is doing. And this is Max and the Beast signing off.